Well, hi everyone. My name is Emma. I'm from the Unova Center, and I'll be facilitating this evening's discussion on COVID-19 vaccines and East Asian medicine. Before we dive in, I wanted to let you know a little bit about all of our speakers. Dr. Noah Rubenstein is a doctor of East Asian medicine, a licensed acupuncturist, board-certified clinical herbalist, and the chief clinic director of the Unova Center. He's also a New York paramedic and a volunteer COVID vaccine administrator. Noah has been in practice since 1997 and draws on a wealth of experience to treat everything from reproductive health to respiratory conditions and more. With a Western medical background, as well as extensive training in Eastern medicine, Noah recognizes and uses the benefits of each to effectively treat his patients. Dr. Lauren Dahlberg is a doctor of East Asian medicine, a licensed acupuncturist, and a board-certified herbalist. Specializing in women's health, fertility, family medicine, and emotional health, Dr. Dahlberg's mission is to help bring utmost health to her patients. With over 20 years of being in the wellness world while sharing her love of East Asian medicine, she is constantly in awe of her patients' transformations, fostering profound changes in their health and well-being. After living and practicing in Buenos Aires and New York City, Lauren lives in Nyack, New York with her family and is the owner of Two Rivers Acupuncture. Dr. Heidi Levy is a doctor of East Asian medicine, a licensed acupuncturist, and a board-certified herbalist. In addition to her private practice, Levy Acupuncture and Healing, Dr. Levy is a faculty member and clinic supervisor at Pacific College of Health and Science, where she teaches women's reproductive health. Dr. Levy primarily focuses on autoimmune conditions. However, she regularly works with all aspects of reproductive health as well. While working on her doctorate, Dr. Levy developed a passion for functional and integrative medicine. She firmly believes that the future of East Asian medicine involves collaboration, transparency, and modern clinical knowledge. And then we have Dr. Ingrid Bauer, the co-founder of Five Flavor Herbs. With experience that bridges Western and Eastern medicine, Ingrid brings rigorous scientific knowledge to Five Flavor Herbs. A graduate at the UC Berkeley UCSF Joint Medical Program and the American School of Herbalism in Santa Cruz, California, Ingrid integrates plant-based medicine into mainstream healthcare. Ingrid is passionate about bringing holistic care to people from all walks of life. I'm sure our panelists will reference lots of articles and studies. I want to let you all know that I will send a recap email following this event with all of those links, as well as more information on how to get in touch with our panelists. I also wanted to thank everyone who submitted questions prior to this discussion. We'll start with those, but if you have questions throughout, please feel free to add them in the chat or the Q&A section, and we'll do our best to cover as much ground as we can. And with that, I'm going to pass this off to Noah to get started.
Hey everybody, welcome. Good evening here in New York. Good afternoon for anybody out on the West Coast who's watching this or anywhere else. I wanted to say thank you all for joining this conversation and coming to hear us. This is one of the more important conversations that we're having these days. And I just, while I was thinking about how we would start this, from the beginning, one of the questions that's come up for me, and I think for everybody else here, is I thought you're a natural practitioner. Why are we talking about vaccines? And part of the reason that we all came together here was because each one of us believes that our patients' health is based on them getting the best that every kind of medicine has to offer. And we all have backgrounds and traditions that are in Chinese medicine, herbalism, conventional medicine, but then we have interests beyond that. And with those backgrounds, we felt it was important to give a natural doctor's perspective on this, on the vaccines, information about COVID itself, and yet with a bit of a focus on vaccines. Which, vaccines are kind of tricky because we all know that there are medications that sometimes have side effects. And we usually balance those side effects up against the benefit of the drug. And vaccines are in a different class because vaccines are something that we do proactively. Over and over, we've all heard or felt ourselves, I feel fine, why would I get a vaccine? And so the inner dialogue, as well as the conversation amongst ourselves, is a little bit different on this particular topic. Everybody here is not by definition pro-vaccine for every condition out there because we're not. We're more thoughtful about this than that. But on the topic of the COVID vaccine in particular, where it's from, where we're going, this was an important conversation for us all to have because there's a ton of information out there. Everybody here on the panel and watching this We are all now armchair virologists. We're all armchair public health specialists. We've learned new meanings of terms like essential workers and frontline workers. And this has just been a really challenging time. So with all of this information, we're hoping to share a little bit of clarity this evening and maybe answer some of the more pervasive questions that are out there so that you feel more comfortable with it. And for if you're a practitioner, a little bit more comfortable talking with patients about it. We're obviously all supportive of getting the vaccine, but we encourage conversation and questions from anybody who's hesitant or uncertain about the vaccine, because this is just a lot of information that we're all kind of working with here. So again, welcome. Thank you for joining us.
Yeah, thank you everyone for being here. I thought a good question to get us started would be if someone could explain the difference between the mRNA vaccine and the viral vectors and how they differ from the vaccines that we're used to seeing.
Ingrid.
Sure, I can speak to that. Absolutely. So I think one of the things that I've heard a lot about from people, especially initially when the vaccines first came out, was sort of this, well, these things came out really, really fast. This is brand new, never been tried before. I don't want to be a guinea pig. Lots of questions like that. And so I did some digging, and actually on the blog, I wrote about this topic. I did lay this out, and that's on the 5flavorsherbs.com website, which will be linked. But basically, the mRNA vaccines are the ones that many of us are the most familiar. In the US, that's Pfizer or Moderna vaccines. And basically, this is a technology that's been in the works for over 15 years. There's been a ton of research. Actually, the biology behind it was really done before that. But in terms of the first attempts at having vaccines that use this technology about 15 years ago, this is just the first time it's actually come to market. And basically what this does is it uses a very tiny piece of the modified coronavirus spike protein, messenger RNA, combined with a sort of lipid coating that goes into the cytoplasm of your immune cells. It does not go into the DNA itself and doesn't interact with our DNA. Messenger RNA is actually what our own DNA exports out when it replicates or when it opens up to transcribe a piece of our own protein that needs to make more of. And so this sort of mimics that, and the mRNA goes straight to our ribosomes, which are these protein factories within the cells, and then assembles the spike protein, exports it out to the edge of the cell, and then that spike protein goes out and stimulates an immune response. This actual genetic material degrades pretty quickly in the body. So we think within a few days it is completely degraded and then has basically been broken apart and disappears. And what we're left with are a certain number of these spike proteins, and then the antibodies, and then the B cell memory cells that give our immune system the training it needs to be able to respond if it encounters a virus in the future. So that's really a basic thing of how the mRNA work. The viral vectors, that technology has been around a little bit longer, and it is similar to the technology used for the vaccine that was developed against, Ebola, thank you. So it's the same technologies used for the Ebola vaccine, and it's really been studied since the 1970s. Similar uses a process to the mRNA, but rather than packaging it just alone in a bubble of fat molecules, it actually attaches it into an inactivated adenovirus, a common cold virus, so that it gets into the cell in a different way, because our bodies already recognize that other markers on the outside of the cold virus. So that's the main difference between the two.
Thank you, that was super helpful. Another question we got was wondering about if I've had COVID already and have the antibodies, do I still need to get the vaccine?
I'd love to speak to that one
Yeah.
as well. And then maybe open it back up. So there are, I think that the data on this right now is very, very good to demonstrate that if you've had COVID before, you probably have a decent amount of time period where you have pretty good protection, at least to the variant that you had. Now, may or may not have good immune protection to the next round of variant. So that's already happened in places like Brazil, where in cities like Manaus, where we heard a lot of news stories in the beginning of the first wave around when New York had its, Manaus had about 70% of the adult population get COVID, which was probably the original strain of COVID. They ran out of oxygen. They had a terrible health crisis. And then the virus kind of went away. Many people assumed, hey, we're all immune, we got it. I think it was about 8 months later, they had another wave with the Brazil variant and almost the same percentage of the population. So definitely a lot of overlapping people who didn't, who had already had COVID got this new strain. So even though there's good evidence that, yeah, you have some protection at least for the first 6 months, maybe antibodies hanging around for at least a year after getting COVID from a natural infection. One, we don't really know if it protects you from the next variant. And what we do know is that getting the vaccine after that gives you what a friend of mine called almost superhuman immunity, is that you are so much even better protected that it's worth getting any one of the vaccines after having COVID once you've recovered and you feel ready to take that on, because it's so likely that it's going to prevent you from getting sick for a very, very long time. And we'll link some of the studies that demonstrate this in the resources.
And I'd like to add something to that really quickly, because this idea of multiple vaccines and boosters and getting the vaccine once you've had the infection, this is actually a new conversation to a lot of us because we've just never been in this position before. The closest thing is getting regular varying flu shots. But this is not the first time that we've seen the value of getting a vaccine either in some numbers, like we do with hepatitis vaccines often, or once a person's already been infected, because of these very issues of variants and waning immunity, where it takes a couple of times. It's kind of like your body is learning something the same way we learn anything. And learning how to recognize and manage an infection, especially with a range of variants, is something that might take more than just one exposure, even if it is a natural exposure.
Thank you. I also wanted to just address, there's some comments about if we're going to touch on East Asian medicine and COVID more generally, and we will definitely cover that too. But as a kind of a bridge between the two, I was wondering if you could speak to how East Asian medicine and acupuncture can be used to help prepare for the vaccine as well as recover from the vaccine.
I can actually touch on this because one of the places I was looking at this question before, and one of the places that I want to go with it is to actually differentiate between how the body's reacting to COVID and how the body's reacting to the vaccine. So if we look first at how the body's reacting to COVID, I actually just wrote a paper on this, where there is this doctor in the 1600s that watched 3 subsequent waves of bubonic plague come through. And what he noticed with the plague, he was able to pinpoint the difference between something called a lurking pathogen and a passing pathogen. So a passing pathogen goes in, it goes out. This is your cold, this is your flu, no harm, no foul. We're kind of over it in 2-3 days. A lurking pathogen, he equated to a bird hiding in a nest or an animal in a den. And so this actually corresponds to this idea, this reservoir theory that we're seeing with COVID, and that once COVID passes the ACE receptors and it goes in deeper into the body past the mucosal surface, it can hide, and it's hard to flush out. And so what I've been seeing here in New York over the past 18 months is I've been treating long COVID, and all I've been doing is chasing COVID out of like nooks and crannies in the system. So how the vaccine is acting to this, right? Is another way to think about these vaccines is it's kind of like showing a mugshot of like, this is the bird, right? Remember this, now we're going to tear it up and like, go get it, right? And so what we're seeing is how do we prepare for these vaccines is I'm having patients come in starting about a week before. And what we're doing is, remember, acupuncture doesn't actually add anything to the system. It only triggers the body's innate response to heal itself. And I found that what it does with the vaccines is when I have patients come in, maybe 1 or 2 treatments before, the day of and following, it's actually, the vaccines have been a nothing burger. An absolute nothing burger. And I treat most of my practice, like we referenced in the beginning, is autoimmune. And so I had a special interest in myself, autoimmune as well. I had a special interest in like, well, how is this going to impact the patient base? And it's important to note with the immune piece to it, you can have people who are immune compromised, which is different than people having a hyperactive immune system. And there is special interest in the autoimmune community, people who had hyperactive immune systems, seeing what their bodies were going to do with it. Like if somebody had lupus or Hashis or MS or whatever. And I've been digging through the research, and the studies are few and far between because not a lot has turned up with that. What we are seeing is we're seeing sequela of COVID kicking off autoimmune because of mimicry that's happening, but we haven't seen it interact with the vaccines the way that we thought we would. So I think when we're talking about how can East Asian medicine help to people prepare and recover from the vaccines, you know, what this old theory said, right? That one of the last takeaway with this old theory was that when they were talking about the constitution of an individual, there are some pandemics and there are some viruses and there are some diseases. It doesn't matter how good your constitution is that it's not a matter of if, it's a matter of when. However, what he noticed in this theory was people who have stronger constitutions, it's a matter of how well you recover. So in terms of East Asian medicine, it's coming back and focusing on that patient's pattern and kind of sealing up the cracks in the pattern before they go in for the vaccine. And I found in private practice, it's been delightfully easy, like easier than I thought it would be.
So someone was just wanting some clarification, and actually this echoes another question that someone else had submitted too. So Heidi, I wonder if we could keep you in the hot seat, but they were wondering if they weren't sure if they interpreted what you just said correctly. So the vaccine is safe for autoimmune and that no data has shown up showing that it isn't. Is that what you've seen so far?
Absolutely. No data has shown up showing that it isn't. And they've also been looking at the impact of COVID on people who have autoimmune and what that's looking like, right? So if you have lupus, lupus is actually a very good example, right? So if you have lupus and you wind up getting COVID, what does that look like? What they've discovered is that there's actually no correlation. And a lot of people who have the hyperreactive autoimmune diseases, they're actually faring better. And now the question is, are they faring better because of the medications they're already on? Or are they faring better because of the autoimmune? And this is something that we're still trying to understand and riddle out. And that's a conversation I want to put a pin in and actually revisit it in a year.
Cool. Thank you.
I'd like to just add one quick thing to the gist of what Heidi was talking about here with autoimmune conditions. And that's this idea of what we sometimes call lurking pathogens or hidden pathogens, because one of the things that we've seen when a practitioner or doctor talks about chasing down these elusive signs and symptoms of COVID infections and us trying to get ahead of that curve with treating people before vaccines, this concept of lurking pathogens is something that we talk about quite a bit in traditional Chinese medicine. It's at the core of a lot of infectious medical thought, but it's also not something that's foreign to conventional medicine either. Something that people are much more familiar with is shingles, which we have a much different concept of from a Western point of view, because we understand, the microscopic components of it. But here is a pathogen that quite literally, long after an infection is gone, can hide in parts of your body that your body is just not going to attack, because it would be counterproductive and self-destructive. And it's a smart virus. It's the herpes zoster virus, and it just kind of lingers. And it's when there's some compromise of the patient's immune system that we see any of a host of things, most recognizably the skin patterns that we talk about as shingles. But it's far from limited to that. There are many other physiological things that go on when that virus is liberated or opportunistic down the line.
Talking. Oh, sorry. Yes, Lauren.
So just, listening to what everyone's talking about and just, adding some things that I've been seeing, well, first with the lingering virus, this is something that Chinese medicine does very well, and we really do understand it. We understand, we have formulas specific to different types of viruses and how they transmutate and what they become, and that we're seeing with COVID, that it's very sneaky and it's very smart. So a lot of times when we're able to treat it, within the first week or so, patients end up not getting long hauler syndrome and may not end up in the hospital. With that said, I've been back in, I've been practicing since we were essential, which is about 2 months after lockdown. That's when we started practicing again, I think most of us. And in my clinical practice, it's not a huge practice, but we see a good 120 to 130 patients a week in here. And I will say confidently that we haven't seen any vaccine injuries, any vaccine side effects that lasted more than a couple of days. And I think that people should know that, because there's so much hesitancy and worry, whether people are afraid about inflammation or different issues or injuries or side effects. And with me personally, I had a really bad headache. I did take, there are Chinese herbs that do help. They have to be prescribed by an herbalist. They're, typically herbs that are given to a specific type of, illness or flu. That's a type of temperature almost. We call it the Xiaoyang, but they have to be prescribed by an herbalist. I took them. I also took ibuprofen because my headache was pretty bad. But after a day of that, I felt better. What I have seen a lot in my clinic, and I think this is so important, and what worries me about COVID, besides the mortality rate, is the long COVID. I've treated teenagers, as young as 15 years old, and luckily haven't really treated kids yet. I've had some phone calls, but we haven't really seen them yet regarding long COVID, but a lot of adults and just a lot of issues. I even had a stroke patient. So that is something that, I think is really important that the public does know. And even what I tell people is, usually if people have these injuries or side effects, they would most likely come to seek out alternative medicine, because Western medicine might be able to help them. And I haven't, knock on wood, but I haven't seen any with the vaccine. So that's all I want to say.
Yeah, and someone had actually mentioned, it's interesting that you mentioned inflammation. So you haven't been seeing a lot of inflammation with the vaccine alongside getting the vaccine?
No, with COVID, yes, but with the vaccine, I haven't. I know that we're going to bring this up later. There's been, some women do have some shifts in their menstrual cycle. We're going to talk about that. It's usually very temporary. But as for inflammation, no, I haven't seen really anything.
It's actually a great segue because there were so many questions about menstrual cycles and we just got one in now. So I think that's a good opportunity to move to that. So someone just asked, they said that they have multiple friends who got the vaccine and it impacted their menstrual cycle, which they are still dealing with months later. Are you also seeing and hearing about this? And if so, what are your thoughts on that?
I'm seeing some of it. It's not as common as, you would think. It's like, let's say, I would say, probably 70 to 80% of my patients are women's health patients. Personally, my other practitioner, she sees a lot of different stuff. But in those patients, I would say probably about 30% of them have had some changes, and usually things regulate after a couple of months. Nothing that significant, maybe it's more, the period might be more cloudy, it might be a little irregular. There might be, just it might come earlier, it might be lighter, heavier, nothing so significant that has affected them, tremendously. And it has regulated. And then also with fertility, I've had a lot of patients, I can say like many who've been, that have gotten pregnant, who've been fully vaccinated. And so that I haven't seen any issues with that either. So.
Great.
And
yeah,
I was just going to say, just to kind of move this part of the conversation in the direction I think that it will invariably go. A lot of people know that last week the FDA approved or revealed that they were going to put over $1.5 million into studying the effect of the COVID vaccines on menstrual cycles and on reproductive health. And one of the things that we've already started really getting some perspective on in this conversation is that there is an immune response to COVID, to the vaccines, and it's a question of how much information we give the body around the vaccine or around the virus that's going to kind of drive those reactions, that inflammation, those fevers, all of those other things. And it's when the statement that this study was going to be done came out, it seemed at first glance like a bit of an aha moment for some people that, okay, see, there's clearly something that it's doing that's really bad to women's menstrual cycles, and we need to identify what this is. But if we take a step back and we acknowledge that the vaccine is in fact causing, triggering, and instigating an immune response that is akin to, but obviously way different than what the virus itself does, then we begin to realize that the immune response that the vaccine may be causing, that may be having an effect on women's menstrual cycle, on people's menstrual cycles, is the result of a whole constellation of things, not just the vaccine, but this research that the FDA is going to be doing will also look at nutrition, lifestyle, stress, a whole range of things that everybody is going through right now. And it would be irresponsible. I welcome the study. I think it's a great idea because it's going to give us information that begins to tease some of this stuff out. But I want to just kind of take a position that the possibility that it's just the vaccine and not this constellation of other factors that we're all living through, but that it's just the vaccine that's causing changes in menstrual cycles is I don't think taking the whole picture into account.
Yeah, and I just want to add one more thing, is that what I have seen also is COVID affects your menstrual cycle. So one of the things that we kind of understood early on with COVID from just learning from our colleagues in China and how it was, it hit there first, and understanding how the virus was transforming in the body, is we know that it causes, in Chinese medicine, blood stagnation. So in Western medicine, they realize that it's affecting the vascular system. So it really does affect menstrual cycles, and then also they're affecting fertility. So that's something that I wish that I can, convey out to the world, is if you're worried about getting pregnant, having COVID is in many ways can affect it in a more negative way. And then also being pregnant right now, there's so much coming out from ICU nurses of, unfortunately miscarriages, stillbirths, and, women that are sadly passing away who are pregnant because of COVID. And so I think this is a really important thing to think about with COVID versus the vaccine. And I can't stress enough how if there is some kind of temporary, even through the study like that, they might find there might be some temporary correlation between getting the vaccine and the cycles being affected, and the weight of that versus like actually getting COVID and how much that can really affect your reproductive health. So.
Well, and to tag on to this, Laura, real fast too, we're still trying to understand why women have a higher rate of autoimmune disorders. And so the way that the endocrine system interacts with the immune system is another kind of clue. And I'm not gonna say it's a red flag, but it's more like a pink flag, right? It's another clue as to why the COVID virus itself is disrupting the endocrine system with this blood stasis. What we've seen though, is when we pay attention to the Wei Qi, when we pay attention to the Shaoyang, when we work on building blood and we work on, because we do well with systems. That's the beauty of Chinese medicine. We do well with the endocrine system, the immune system. And when we can harmonize those systems, what we see is that the autoimmune hyperactivity starts to calm down. The inflammation starts to calm down. And what we're seeing with the vaccines is that even if it does disrupt the cycle, is with Chinese medicine, I've seen in my private practice, we've been able to get the cycle tracking within a month or two. What I've seen with COVID though, when I have long haulers, it's taken 6 months to get the cycle back on track. And I've had like patients who they came off birth control, and then when they went back on birth control, they were back to long haul symptoms. When we had pulled them out of long haul, it brought the long haul back. So we're still trying to understand the interaction here, but we're not seeing it with the autoimmune to the level that we thought we would. So for me, what it's come down to, and again, like I'm New York City biased, and what we saw here in the city with long haulers is, as my sage bookkeeper has said, at this point, you're going to get the vaccine, you're going to get COVID, or you're going to get both. And so, and I feel like I can treat the vaccine better. And listen, like I see long haulers all day, every day. I can work and treat the vaccine better. And it's easier to get over that than the long haul with COVID.
I want to keep going with the reproductive health questions, but I noticed one come in about vaccines for people with autoimmune conditions. And is there one that would be more recommended for someone with an autoimmune condition, or not so much?
I'm team Moderna, but I've been team Moderna for a while. I originally, when things started coming out, I was team AstraZeneca, but I was holding off on it until I saw the studies. And when we saw the studies come out with AstraZeneca, I quickly changed my tune to that. What I've seen with the J&J in my patient population, because we're New Yorkers, we like things quick and fast. So people are like, one shot and done, that's great. But we're seeing that their immune just isn't like holding the same way. So whether it's Moderna or whether it's Pfizer, I think you just have to do whatever's accessible to you. And if there is autoimmune, you want to be calming the autoimmune as much as possible before going into it. But again, like the reaction to the vaccines with now again, you have to talk to your physicians with this, your practitioner with this. This is a team decision before going into it. But we have just not been seeing the type of, apocalyptic reactions we were expecting with it.
Cool, thank you. So we had another question so someone wrote in saying that they were breastfeeding and they were concerned about getting the vaccine, and they were wondering what your thoughts were on getting the vaccine whilst breastfeeding, or if there's any guidance on timing.
I can speak to that. So I would definitely advise getting it. And from what I understand, and correct me if I'm wrong, that you might be able to pass on antibodies to the baby, and that's a really good thing. But definitely, when you're breastfeeding in Chinese medicine, all of your blood and your qi that should be going to you is going to the baby. So your immune system might be lower, just like when you're pregnant. And typically in the United States, what we see postpartum is women aren't really nourishing themselves as they should. They're not really taking the rest and the time, and their diet might not be really building up and regenerating blood and qi. So I definitely would advise during that time that you're probably more susceptible and your immune system might actually be decreased. So it would be a really good time to get vaccinated.
Thank you. That's helpful. We had a question about long-term data around this vaccine. So I'll read out this one that was in the chat, but we received a few similar ones as well prior. So they said existing data has shown that vaccines have been safe and effective. However, since the COVID vaccines have been developed recently, how is it possible to determine the long-term safety in the absence of long-term data?
Well, Ingrid, and then you're on mute.
I was going to say, go ahead, Noah, and then I'll follow up.
Okay, great. So in terms of the long-term data around side effects from the vaccines, there are two things. One, getting back to where we started the conversation, where Ingrid was explaining the technology behind this. One of the things that's really concerning to a lot of patients and a lot of people is the technology itself. Is the mRNA technology safe? And as Ingrid pointed out, the technology itself is safe and it's effective, and we're going to see mRNA technology looking forward. It's going to become ubiquitous. It's going to become much more the vehicle because it is quick, it's effective, it's economic, and it's safe. We've been working with this technology for decades now. And sometimes we'll come across research from like the early 80s showing that it causes headaches that last more than a week. But we've developed the technology. The other part, so there's that concern about long-term side effects. The other part of it, though, is there's a bit of a golden rule of 60 days that if you don't see a significant, meaningful side effect within that window of time, you're not going to see a long-term side effect. And I think I speak for everybody here. We are open to the possibility of something new happening that none of us have ever seen before. However, if it did happen with this vaccination, it would be the first time in history, because we know that the yellow fever vaccine can cause yellow fever. We know that the polio vaccine can cause, we understand what the vaccines can do to actually create problems that they're trying to treat, or other problems like the flu vaccine causes Guillain-Barré syndrome. But this never happens beyond 60 days. So if we don't see it within that window of time, we're just not going to see it. And one of the things that's been remarkable about this vaccine rollout is the sheer numbers, the millions and millions and billions of doses that have been given out. And what that's done is it's given us a massive amount of data to look at. It's done something scary and also shown us that some people do get side effects, because when you have that large a population, that large a cohort, you're going to notice numbers of people who have either changes in their menstrual cycles or really scary stuff like clots or myocarditis. And that, one, it's scary. Two, it shows that systems like theirs, the vaccine adverse event response reporting system, work, because if we know about it, then everybody knows about it. But really the point is we're not going to see long-term side effects. I don't believe that we haven't already seen within that window of time.
I mean, I couldn't have said it better myself. I think that there is a really unfortunate, and I grew up with natural medicine exclusively and Chinese medicine. I was conceived because of Chinese medicine, and used it, and actually homeopathy as my primary medicine until probably when I had antibiotics in Guatemala when I was 15. I received all of the childhood vaccines that were indicated in the early 80s. And then my sister did not, because my mom kind of took a mid 80s freak out about vaccines, and also aluminum and all the other things, aluminum fluoride vaccines, many of the things that we see in natural health communities, which are concerning, but also some of the concern is overwrought and a lot of the data is poor to back up those concerns. So I think we have a really long tradition in many different natural medicine bubbles, whether it's TCM or naturopathy or other practices of herbal medicine, where there's a longstanding cultural fear of vaccines that has bled over into this, and really, I don't think has ever been very well backed by very much data. There's a lot of personal stories and a lot of concern, especially among parents, about vaccine related harms to their kids. And unfortunately, we don't have enough data to make a lot of proof out of those. But in terms of adults experiencing long-term vaccine side effects, if that were true, we'd have a whole world full of autoimmune destroyed people. And yes, there are rates of autoimmune disease that probably have gone up related to more diagnosis and a much more toxic environment. So what I've always sort of said is I wish that the concern that people had around fear of vaccine safety in the natural medicine communities, and I'll make that plural, were redirected to being concerned about glyphosate, to other toxins in the environment, God forbid, global warming and climate change. That's definitely going to kill us all, or at least a couple generations down the line. All these things I think are much more present threats, plastics and antibiotics in our water supply from industrial agriculture, et cetera, et cetera, et cetera. The list goes on. But instead, the focus has turned on this. It's almost like it gets to be the scapegoat for all these other health problems, when we really should be looking at this bigger picture. And in this situation, we are doing a cost benefit analysis where we're looking at, as everybody in the room has really shared, the risk of getting COVID, even though most of us are fine, the risk of having long haul or the risk of being hospitalized or intubated or dying is so massive on the global scale that this is a situation where we have to I don't say throw caution to the wind, but really do a very careful personal risk benefit analysis as well as a social risk benefit analysis. What role do I have in protecting my coworkers, family members, teachers in the school that my kids go to, or God forbid, the nurses who are like overworked and tired in the ICU, to get vaccinated and protect not just myself, but to kind of protect society from the ravages of this pandemic? And that's what I have been since the beginning, encouraging people to just take that. It's not about whether or not you're a sheeple and you're obedient to the CDC. It's not about, is there potential side effects, or is this 100% safe? It's really kind of taking that, like, what is the risk of not getting vaccinated versus the benefit of getting vaccinated for myself and my whole community, and taking that perspective in, as opposed to just the fear of personal harm as the only factor that matters. So that's kind of my overall approach to the safety.
Thank you. That was both of you. That was really helpful. We had a few questions actually. Ingrid, I feel like you might be a good resource for this. We had a few questions about the booster shots, and I wondered if you might be able to speak to them. One question was, do you think that we'll be needing to do boosters every 6 months forever? And then another question around boosters was, do you think that they'll be modified around the variants that we're starting to see?
My answer to both is I don't know. I think that those are questions that are really they're definitely being worked on in labs, both at, in federal health systems worldwide, where there's research, as well as in the companies that have designed them. And because this whole situation has really been, first we were day to day, they were week to week, they were month to month, and they were back to week. The data has been changing so rapidly, and there's so much of it to sort through that I don't think I could speak to any of them at this point. It sounds like very soon the FDA will take the advice of the advisory committee and recommend that individuals over 65 or those at high risk get a second shot of Pfizer. A second shot of Pfizer or Moderna is already recommended for those who are immunocompromised. So I just, for example, a patient of mine who's on chemotherapy for breast cancer, she just got her third shot yesterday in our clinic. Now Johnson & Johnson and Moderna are presenting data to the FDA to recommend for J&J a second shot and for Moderna a third shot. Again, is this going to change in 6 months? Probably. Are they going to tweak to include, our mRNA samples from other variants? Quite possibly, but I am not in those labs and I can't speak to it.
Thank you.
I just want to tag one thing on there where just this is one of those things where perspective and framing actually comes into something as technical as medicine. We talk about the boosters like they're a luxury, and I am 100% personally behind the idea that we should seriously be considering global distribution before boosting ourselves. There's a public health conversation here that if we don't have it locally, communally, nationally, and globally, we're not having the full conversation. With that said, and it's irresponsible of us to not have that conversation. That might be as political as I get tonight, maybe not. But with that said, we talk about the boosters like they're a luxury, but in fact, there are, once again, vaccines that we know take more than one, more than two. Right? Coming back to something like hepatitis B, where there is a schedule, and this is actually just the third, this could conceivably be the third of a ramp up that are just the initial vaccine shots that people need. To Ingrid's point, there's a lot that we still don't know, and that should not be confused with a wishy-washy throwing caution to the wind. We don't know, but we're learning. I mean, the entire world, we're learning every single day.
Thank you. I just wanted to quickly acknowledge that we don't have all of the time in the world, and I see so many really great questions coming in. So I think what we'll do is we did get a lot of questions about immunity support, both with the vaccine and without the vaccine. So I'd like to spend some time speaking to that. But I have made note of these other questions, and I will get answers to them and send them in the recap emails. So thank you for sending these questions. So one question that we had around immune systems was wondering if you could share some practical things that people can do in their homes with their families, especially for people who have kids who aren't of vaccine age yet, in order to boost their immune systems.
I can talk. So one thing I recommend is, well, first, if you know of a Chinese herbalist, get in touch with them, because there's some great formulas that is what they do. There's formulas specific for boosting your immune system and helping with lung support and going into the winter months and preparing for that. Also, just something that's really simple as well is diet. In Chinese medicine, we are huge advocates of dietary therapy, and a very simple thing is, which sounds a little counterintuitive to a lot of Western health food lovers, is eating warm. So we don't love, the general smoothie juicing salad. I call it the post 1970s Jane Fonda diet. It's more about eating a traditional diet. So think about how your grandmother cooked. And there's a whole reason behind this. It's kind of a science to us in Chinese medicine and why. But in preparing for the winter, you want to keep the gut warm. And we have this little organ called the spleen. That's a cold, damp organ. And it's actually related to the lung. So the spleen is the leg tie-in and the lung is the hand tie-in. So they're a little couple. And the spleen is a cold, damp organ. So in Chinese medicine. So it gets kind of sad when it gets lots of smoothies and juices and salads and ice. So ideally, and too much sugar. So you want to give it warm food. So we love like chicken soup and root vegetables and just soups and stews and cooked things, steamed vegetables. So that's just something that you can easily do at home. And that just helps so much with preparing for your immune system, your lung health, and general health. So, and if you think about Asia in general, the food is typically warm. So soup is eaten for breakfast and lunch and dinner.
And then I'll jump in too. So one of the things that I've been recommending, because I saw another question like pop up, like acupuncture, other modalities, right? So I usually recommend patients come see me once to twice before getting the vaccine, right? I usually recommend that if they can come in the day of the vaccine, either before or after they get poked, totally fine. I'm recommending things post-vaccine such as sauna. I've seen when people go sweat in some way, like that seems to help. I've seen with the arm pain in particular, like that frozen shoulder, that everything that we're talking about. I'll usually wait 48 hours afterwards, but I'll cup the back, not the site of where the vaccine was administered, but I'll cup the back, I'll cup down the SI, I'll cup down the Sanjiao, and that seems to get it moving enough and unlocked in such a way. I am a huge proponent of Moxa. I've turned my office into an opium den, basically. I can't tell you, like I go through pounds of it. Like I'm surprised we haven't been kicked out yet, but I'm usually doing like Moxa boxes. I'm doing all of that. Again, acupuncture itself, it's an immune modulator. So, and as we're kind of playing with the immune system, to have that acupuncture tag teaming on either side of the vaccine, I've seen anecdotally just do wonders for people. And there is one other question too, is if the vaccine doesn't stop transmission, how is it helping the community? Well, it's helping the community. There's actually a study out of King's College where they discovered that the vaccination lowers the odds of long COVID by 8 to 10-fold. So if you live here in the Northeast, something that's epidemic to us here is Lyme's disease. And we're starting to equate how Lyme's behaves the way that like long haul COVID behaves. So if we can keep people out of long COVID, that's going to have economic, financial, health impact that extends beyond our household into the community.
Thank you. That was
Yeah, and I want to just add to that one more sort of PSA on public health and frankly health equity. One of the main reasons we're going to see breakthroughs, and in places like Israel, Great Britain, the countries that are often pointed to as high vaccination rate and high infection rate, they're often referred to or pointed to as examples of why it's not even worth getting the vaccine, because people are going to get infected anyway. And the difference of experience for the individual is, as Heidi's suggesting, is the difference between arguably what could be a bad flu and something literally catastrophic, if not fatal. On a public health level, we see the statistics are, it's not even debatable. The ICUs around the country are populated by patients who are in there who have COVID are over 98% unvaccinated people. And so it's not just about the vaccine. There's a downstream consequence to putting strains on medical systems that prevent other people with non-COVID related conditions from getting quite literally life-saving care. So bringing together a couple of the things that we've spoken about over the last 15 or 20 minutes, there's a public health concern, there's a community concern, there's a beyond the scope of COVID concern that is involved here as well. And
also just one more little thing about spread. So So I did see a study today, and it was kind of a quick glance, that, and I think it was from Israel, that they studied, it was 11,000 people. And they said that through that study, they were able to see that there is actually less viral load. This has been kind of controversial, but that there is less viral load if you're a lot less when you are vaccinated. So maybe at first it might like hang out in your nose and there might be a lot, but after what, the reason why vaccinated people are able to get better quicker or might have a more mild case is because it's not as intense and the viral load is a lot less. So this kind of, I saw this today, it might be within the last day or two, but I think this is really important because, it's, if you are not vaccinated, you have a very good chance of getting it. I think it's like 1 out of 8. And then spreading it. And if you are vaccinated, it is like 1 out of many thousand. So it's a big difference of, and then also what Noah is saying about just there are people who cannot get surgery right now because the ICU beds are filled, and it's a horrible scene in the hospitals. So it's also about the greater community. So
Thank you. I think we're at the end here. I don't think we have room for more questions, but I want to say that I wrote down all of the questions that I saw come in, and I'll do my best to send responses. And I made note of all of the research that the panelists had mentioned, so we'll send all of that over your way as well as obviously a recording to this. But I just wanted to thank all of you for being here, and thank you to our panelists for your insight. This was super interesting. I definitely learned a lot, and I'm really grateful to have spent this time with you. Thank you.
Thank you.
Thanks, everybody.
Thanks. Great. Have a good night, everyone. Thank you so much.
Bye, everyone.
thanks for hosting this, guys. It was great.
This is fun. We'll have to do it again. Bye.
All right. Bye. Thank you.
Bye.